Good evening, folks. Welcome to another episode of Liberation Lighthouse.
Liberation,
Yeah!
liberation, liberation.
For all of you out there, all both of you that are watching us, thank you for joining us on tonight's episode. And we could just rant and rave about random things, but we decided to start um, kind of giving you a format. So on tonight's episode, as promised last week, today we are going to be talking about MDMA. Yay! Also
So
known as Molly,
essentially,
ecstasy, the party drug, whatever you want to call it. However, we're not going to be transmitting from a rave. Instead, we're going to be looking at how it's used to treat PTSD. Apparently, MDMA is one of those drugs that has become very useful when treating PTSD. And fortunately, both Chris and I have had some experience in dealing with MDMA as a therapy for PTSD.
Mhm.
So, Chris, what do you got
so
to share with
on
us?
on tonight's episode of Drugs with Rod and Chris,
Drugs with friends. Sounds horrible,
drugs with.
doesn't it? Yeah.
Well, again, I just find this fascinating. Then we'll get into why MDMA could be so powerful, especially for healing certain things, especially for PTSD. Um, but just as a reminder for those who haven't listened to all the episodes, Rod and I grew up in the the dare age.
I remember it as the
Drugs.
just say no.
Yeah, the just say no age. There we go. The just say no age. And so if you would have told a younger version of me that I'd be like, no, no, like MDMA, ecstasy, like, no, take that. That's great for therapy. I would have been like, what are you trying to peddle?
Yeah.
But the truth is, what we're finding more and more, and there's plenty of research to back this, is that certain medicines, call them medicines to just differentiate between when you're taking it as a drug, like let's go out and party, or when you're taking it with a purpose, i.e., to heal or resolve something. That certain medicines have a profound effect. And because we're living in a world that currently has a lot of unresolved emotional experiences, sometimes that's called trauma, sometimes it's something more formalized like PTSD. But we're just going through the world with a lot of shit and tools that help us do that, not to just escape it for a little while, but to truly resolve it so that we can live better lives. Like that is powerful.
Yeah. And a quick disclaimer, I know we're joking around and kidding and whatnot, but don't go to a rave and take MDMA and thinking you're going to just be woke the following day. It doesn't work like that. Most of the time, when you do end up buying whatever it is you buy at the raves, it's not really even MDMA. It's going to be, random drugs all shoved together to give you a feeling of euphoria. Where MDMA is nothing really like that. It's more of a heart opener. And I actually had a hard time believing that this drug could be used as a party drug based on my experience using it as a therapy. So again, when I was when I was going through it, what was it, almost 2 years ago, when I was
Yeah.
using it as therapy, there is no way I
Sorry,
thought
Rod.
this thing.
Rod, like almost 3 years ago. We're at 2.5 right now.
Whew, man, almost 3 years ago, when I underwent it, there's like no way I felt that anybody could go party on this thing. It was just so for me, the experience with the therapy, with being guided through the entire thing, it was not, hey, let's turn on some techno music and get the strobes going. It was definitely a very introspective. Uh, what happened, what went wrong type of medication for me. It was not, uh, oh, let's go to a rave and have a good time. I know that's what the movies
Yeah.
and the TVs portray, and I know that I think it's a misnomer to call MDMA or to put MDMA in the same arena as the mollies, the ecstasies, the whatever it is that they're peddling at the clubs and they're referring to as MDMA. It's honestly a disservice to this medicine, and it probably, I don't know why it started like that. I'm guessing initially the drug was probably MDMA, and as it got stepped on and it got mixed with other chemicals to bring out the party experience. The actual MDMA portion of it just got smaller and smaller and smaller to the point where it is my understanding that what is known as MDMA or Molly out there doesn't even have any MDMA in it. It's other methamphetamines that are now in there, taking its place and stealing the name. So
Yeah. And I think this also goes, and I see Josh's question. We're going to answer that in just a moment, Josh, because it's a name that I never remember how to pronounce. Um, but the other thing here that this goes to talk about is the true importance of setting, and intention. We covered this in the last episode, I believe it was. Two ago, when we were talking about cannabis.
yes.
So 2 episodes ago. But if you really think about it, like another difference between the chemical being used or the medicine being used and uh, where you're using it, like using a medicine and using it in a place where there are lights around and it's going and your eyes are open and you're dancing and you're in that experience, again, can be completely beautiful. There's nothing inherently wrong with that. Might be illegal, but it's nothing inherently wrong with that. However, that's not the medicinal therapeutic purpose, right? That's where the setting of being someplace safe, often having an eye mask on, often having a guide or a therapist there to help to guide through the process and allow for the internal reflection. The internal, it's like instead of like putting all of that energy out, you direct that energy internal. And with that, that's where you can begin to resolve a lot of the emotional experiences and challenges that are causing hurt, pain, triggers, trauma in one's life.
And that said, I don't want anybody out there to feel that, oh, okay, MDMA is good for PTSD. I could go to my local neighborhood, dealer around the corner and get him to hook me up with some Molly because it's the same thing, right? And then come home and try to experience this therapeutic drug on your own. You definitely need somebody there to kind of guide you through it. You definitely need somebody there to make sure everything is running smoothly. You definitely need somebody there to administer CPR if they have to. This is one of those drugs where if you take too much of it, if you take it incorrectly, if you're a smaller person, if your body chemistry doesn't like it, you could die. Not just overdose, you could die. So please, this is our disclaimer at the beginning of the show. As we're going through this, take everything we say with a grain of salt. There's little links at the bottom with more information. Please feel free to copy those links, go to those websites, get your own information from the horse's mouth. Okay. We
Mm-hmm.
are interpreting the information that we have found, and we're trying to present it in a way that we believe would be beneficial. Okay.
Exactly. And ultimately, like again, you're responsible for your life. You get to make up your own mind. Like that is power. And so we're here to guide, we're here to provide information, but the choice for any of these things is what is right for you right now.
So don't take our word for it.
Bum,
And
bum,
getting
bum.
back to Josh's question here, what is MDMA and what does it stand for? Well,
All right.
the
Are you
official
are
name
you
for
gonna say this
MDMA,
one?
you want to try? I butcher names every week, so please
I
give
know.
it a shot.
I'll give it a try. I'll do this one. I never have said
It,
this out loud. I've always
it's
just
it's
messed with it.
written
So
there, and it's
4 methylene dihexamethylamphetamine. Yep, that's it.
dioxymethamphetamine. I know the last part is methamphetamine, so three
How
four
credible, how
methylene
credible do you believe that we are right
dioxymethamphetamine.
now? Right? Let's just like, yeah. In truth, so yes, that's what MDMA stands for. And as Rob was saying earlier, there are street names for it like ecstasy, Molly, etc. But many times those are actually combinations of other substances. Sometimes they have MDMA in it, sometimes they don't, which is one of the bigger reasons that a lot of places where MDMA can be prevalent will often offer testing services because uh, not only can MDMA on its own, we'll talk about this, be lethal if done incorrectly, but then if you don't know what you're putting into your body, that can be even, for me, I would say scarier, right?
Yeah.
That, and this is a reason that the legalization and the utilization of this in true therapeutic settings.
In therapeutic settings.
in true therapeutic settings is so important.
It is. It is. So the desired effect include the altered sensations, the increased energy, the empathy, and the pleasure. When taken by mouth, hopefully, it's usually in a pill form. Effects will begin within 30 to 45 minutes and can last. And I gotta say, the 3 to 6 hours. I think depending on how much you take, mine lasted about 6 to 8 hours. And as I read from uh, look, different sites, I got the 3 to 6 and the 6 to 8. The therapeutic session, count on 6 to 8. The 3 hour session, this was only mentioned through Wikipedia when I was looking at MDMA. So,
Mm-hmm.
MDMA, just a little history here, was developed by Merck in 1912. That was a pharmaceutical company of German descent. It was used to enhance other psychotherapies, psychotropic medications of the time. It wasn't used on its own until 1970s, became popular as a street drug in the 80s because we like to abuse our drugs no matter what. MDMA is commonly associated with dance parties, raves, electronic dance music. Sometimes it's mixed with other substances. These include ephedrine, amphetamines, and methamphetamines. And that just sounds horrible to me. But if you're going for the party experience, I guess that's what you got to do. And let me see now. Um, when used in assisted psychotherapy, uh, prescribed doses. Okay, again, we the person that is going to be giving you this medication needs to know your weight, needs to know your gender, needs to know if you're on other medications, needs to know if you have any reactions, right? So please, please, please don't just go out there and start taking what you think might be MDMA. Uh, Especially if you want to use this as a assisted psychotherapy. Okay, so please, just again, we can't stress that enough. Research suggests that MDMA assisted psychotherapy for PTSD, including complex PTSD, and those are the two types that are found right now, might improve treatment effectiveness. In 2017, a phase 2 clinical trial led to what they call a breakthrough therapy designed by the US Food and Drug Administration. It's still an illegal drug. However, if you are part of the trials, MAPS, which I'll go over here in another slide, is currently still actively looking for people to join their studies. Okay. The research has been controversial in part because recreational MDMA use has been associated with harmful effects among some users. Again, you can get a lethal dose of this stuff.
And in addition, like being used for, let's say, the rave scene or whatever else, or even recreationally, it can be overused, right? So it can have a detrimental effect upon the sustained overuse of MDMA can have a detrimental effect upon the nervous system, on the brain, on neurotransmitters. Um, it again can be a challenge. So when you're looking at it in a therapeutic session, um, number one is you're really, and we'll talk about this here in a minute, you're only taking it a few times, excuse me, and you're taking a limited dose. And you have a long refractory period, like recovery period, between how often you're taking it as well.
Why would that be, Chris? Why is it taking so long between dosages?
Mostly for integration, right? So like you get to do this emotional work with the medicine, and in those sessions, you will often have realizations. You will often also then clear out various emotional blockages. You can then come to face with and feel through emotions that need to be felt through because you're in this safe space. But the full integration of that will happen over the span of days and weeks. And
Okay.
so most therapies truly benefit from a long integration period. And then secondarily, you want to give your brain, your nervous system, and the neurotransmitters involved a chance to fully recover, come back to normal before you put a strain on them. MDMA is releasing, it's a really unique neurological experience. It's a time when your brain is both high in dopamine, i.e., the get stuff done neurotransmitter transmitter, and serotonin, i.e., the I feel safe and calm neurotransmitter at the same time. And then you have oxytocin on top of it, which is the I feel love and connection neurotransmitter. And so those being in the brain at once is not a natural state. Very helpful for healing, can be very great to experience, but it's not a natural state. And so there can be adverse effects to doing that often of time.
Okay. And this slide is a lot of repetition here. I know there's a little bit of history on the top. The second one, the second paragraph, I really want to concentrate on this part here. It talks about the beginnings of MAPS, which is the Multidisciplinary Association for Psychedelic Studies, began because it was made illegal, and they felt that this was a medicine that could be used in a positive way under the supervision of a trained guide, psychiatrist, psychologist. And they petitioned the FDA and the DEA and were granted approval for research beginning in 2004. The first trials were carried out in 2011. And like I said, from the research that I found, a lot of people are feeling that this year, sometime early in 2022, MDMA will become as available as ketamine in clinics of the same sort. And when I was doing my research for the ketamine just last week, I did note that a lot of these clinics that are around the United States have hinted on their websites that they are beginning to get ready for that legalization of MDMA and to start offering those sessions as well. So keep that in mind, even though it's still considered a stage one narcotic by the by the DEA. They have been playing with it for a while, been doing a lot of studies, and it looks like it may be something that you can get, from a spa, or from, I hope not from a spa, but from a. I was thinking ketamine. Ketamine is offered at a spa up the street from my house. I'm just like, I hope they don't offer MDMA there, but
I
from
just,
a clinician, right? It'll be
yeah.
something that might be readily available from a clinician. In 2017, after all these studies, they were granted what they called a breakthrough therapy designator. Okay, so that means that opened the door for more people to use it, so that they can start getting more data. Okay.
Yeah.
Mr. Josh Gomez is asking, is MDMA an addictive drug? Um,
It can be.
you
I
know,
mean, there are, again, it's the fact that it promotes a particular neurological state that can be addictive. I don't know the answer as to whether it is physically addictive, right? You have some things that are psychologically addictive. You have some things that are physically addictive.
right.
Many drugs, like the opioids, for example, are also very much physically addictive in addition to the psychological addiction. I don't know the answer as to whether or not MDMA is physically addictive. I know from my own experience, I've never done it often enough or enough times for that to be a factor. I know that it's not high on the list of addictability. Like, it's, some people say, again, all these things with a grain of salt, like, you can be addicted to meth doing meth once. And that may be true for some people. I'm not aware of that same addictive possibility or capability with MDMA. I do know of people that have become psychologically addicted to that feel good. So then, rather than doing the work in their life to allow that feel good to be present more and more, they utilize the substance to get there. And you only get there for a certain amount of time. Uh,
And
in
unfortunately, I think
addition,
that's the point in most drugs, right? You want to escape whatever your life is, and you want to get to a
yeah.
point where either you're not thinking about whatever it is bringing you down, or you're just wanting to feel that high, if you would. I don't know.
So the one thing I will put in here that I think ties this is different from being addictive is, can it be abused? And everything can be abused, right? So can MDMA or any of the derivatives be abused? Yes. And is that something to be careful of? Yes. It's another reason that we are advocates of utilizing this in the clinical therapeutic setting. Um, the last thing that I'll share, tied to what you talked about earlier, is if you guys haven't taken a look at MAPS yet, it's maps.org, maps.org. They have been for decades an advocate of getting these medicines out there, getting past the bureaucracy of the DEA and other regulatory agencies, and bringing these into, at least for America, bringing these into the space where they can actually be used as medicines.
Yeah.
So there's a lot of research there, a lot of information, but also I'm just going to say this, like if you got an extra buck, like burning its way in your pocket and you want to donate it someplace that really is doing truly, truly good work, $1 to MAPS could be a great idea. That feels right to you, like because a lot of what we're seeing now in terms of MDMA and other substances being brought in to for truly helpful medicinal therapeutic purposes, they're the ones doing this, and they are a charitable foundation.
And again, we have no association with MAPS. We are just stealing their data, presenting it to you, and talking about this subject. Post-traumatic stress disorder. For those of you that missed episodes 1, 2, 3, 4, 5, and 6, PTSD is most commonly treated by cognitive behavioral therapy, sometimes prolonged exposure and cognitive processing therapy. Eye movement, that's the EMDR, desensitization and reprocessing, the psychodynamic psychotherapy. However, over half of these patients continue to suffer from PTSD. And after completing therapy with results from military PTSD being especially poor. I really don't know why us as service members, when we come out with PTSD, we really love to hold on to it versus somebody that might have had PTSD through just living their lives, right? Whether something traumatic happened to them as a child,
Hmm.
where they were in a car accident, where there was anything like that. Those forms of PTSD seem to have no problems with any of these other therapies. However, for people in the military, and again, I haven't found a definitive answer for this. For people in the military, we are very resistant to try to get the help, or not even try to get the help, just resistant to the help. It doesn't take as easily as civilians, right? Um, again,
I wonder if there's like a, again, like if I'm thinking back through the stories and the movies and everything else, watching it, it's like, the first Rambo that came out, and like there's a story around the not understood soldier. There's almost a badge of honor around some of these things, right? And then I know there's also like the individualism. Like I grew up in military families. Like there's a rugged individualism of we've got this, we're going to handle this ourselves, whatever it happens to be. And that can, at least in my life, that's been detrimental. There are many times I could have asked for help, and I could have avoided years of suffering if I truly knew and trusted how to do that. Yeah.
yeah. What's as I've done research for my own purposes, I found it strange. I went back to Sparta in the Greek times. For those of you that have watched 300, Sparta was a um, a militant state within Greece, right?
Hmm.
That's everybody in that state. If you wanted the right to vote, you had to serve in the military. That meant going in at about age 9 and being trained. And one of the things that they trained for was um, the horrors of coming back. And so this is one of those places where I found it really compelling because they had
Mm.
this whole process of bathing and washing and ritual. Um,
Oh.
a lot of stuff towards combing their hair, putting scents, oil. It was just very ritualistic before you got back, and when you got back, there was more ritual involved to welcome you to wash the
You're
hurt away, you know?
you're literally describing like the de-armoring process. You're
Yeah.
describing the washing the hurt away process. You're describing the reintegration process. And if you're in a society, a culture like that, that is so military heavy, if you will, then there's
Mhm.
also a greater understanding of it as well. And you're not like the odd guy over there that nobody understands and everybody's a little afraid of because it's got the 1,000 yard stare, right?
Right, right.
Um, so like I think that those things combined, there's greater acceptance of it. But what you keyed on, and I didn't fully realize, Rod, thank you for bringing it up, is the rituals that we don't have today of the literal de-armoring, washing the hurt away, and reintegration with society. And those are powerful.
Yeah. Sorry, I get choked up sometimes. So with this ritual, I mean, did it eliminate PTSD? Not completely, no. People still had nightmares, people still had sufferings, but there were groups where even back at home, they would go to, if you would, like a VFW or an American Legion, and still be included in part of this group of survivors, if you would. And
Yeah.
we don't have that. We really don't. I mean, unless you actively go out and look for some kind of a group therapy, even through the VA, I have one-on-one counseling with my counselor. Uh, it's not a group, and even in these days of COVID, it's over the phone. So there's no there's no brothers in arms, if you would, and I think that's what we
Mm.
lost. There's no yeah, I've been where you're at. Usually, it's a therapist. You know their name, and that's about it. They might have a picture or two on the wall of their family, and they generally don't share um, commonalities with you, right?
Yeah.
They
Oh,
they
and
they haven't been in those foxholes. They haven't been through that trauma themselves, or at least they're not letting you know if they have. Out of all the therapists that I've had, I knew of two that actually served. One of them didn't really talk about it, and that's kind of interesting because I didn't want to talk about it, right? And then the other one was still an active duty reservist, right? And so he was still going through it, and I'm like, well, he hasn't really been anywhere. He's listening to all these stories from vets coming back. I wonder what his impression is going to be if he ever gets deployed, right? How is he going to
mm,
deal with things? That was
yeah.
that was the thing. So, but sorry to have gone off on a little train to Pittsburgh there, but PTSD is best treated when a patient is in the optimal arousal zone. Don't think dirty. This is the zone in which emotions are engaged yet not overwhelming. In
Hmm.
this zone, four symptom clusters of PTSD are sedated. These are the re experiencing, the avoidance, negative alterations in cognition or mood, and the alterations in arousal and reactivity. You're being triggered, right? So subjects with PTSD exhibit extreme emotional numbing, right? You just don't feel anything, or anxiety. You struggle to remain in that arousal zone during conservative therapists. I do remember initially when I started going to therapy, just sitting there answering questions and just having this frozen, sitting at attention feeling the entire time. It was just
Hmm.
I'm here because I have to be here, and it was like it almost felt like being captured by the enemy. You don't want to give up too much information, right? It's just like you don't want to admit to things.
We go through that. I had a relationship last year that involved a guide and therapist, and I can see times when I just completely closed down. Like I was just stonewalled like that time because I didn't feel comfortable in opening. And I've been doing this for years, right? So sometimes some of these things are contextually driven, right? Like
Yeah,
if you put me in front of a therapist or with Rada kind of on my own now, like 100%, like I open up, I cry, like I feel the emotions, I move through. Rod's experienced that plenty of times in helping me with stuff. And yet in a different container, a different experience, having to be vulnerable with somebody that I found it challenging to be vulnerable with, then like it just didn't happen. And so I'm sharing this story to go to say also the container with which this is happening, whether you're going through other therapies or you're going through um, MDMA therapy or whatever else it might be, is very important. Like to be in that space with people who you feel a truth is in very, very important. If that's one or if that's many, all they're out. So
Yeah.
know that that is key. And if one environment doesn't work for you, that's completely okay. Nothing wrong with that. Find another environment. See how
If
that one
one
is.
therapist doesn't work for you, go find another therapist. Go find somebody you're comfortable with, right?
Yeah.
So, and again, for some people, if the traumatic memories are revisited in therapy, that when you're just not in the right state of mind, this can actually increase your PTSD. You know, having to
Yeah.
relive it, having to revisit that. So, be aware of that. So, where does MDMA come in? When used in therapy, oh, here we go. Question from Josh. The process also overlaps with the grief cycle. And we did cover the grief cycle a little bit. Let me go ahead and show
Hmm.
this question. Uh, and what sort of help or assistance an individual is open to at various stages and times? Yes, definitely. There's definitely an overlap with pretty much PTSD is one of those beautiful things out there that you get the depression, you get the anxiety, you get the suicidal tendencies, you get the homicidal tendencies, you get the anger. So it's really all encompassing. And when we were talking about some of the other medicines that are used to treat the symptoms out there, yes, cannabis did come up. It's not a cure, but it helps treat the anxiety that's related with PTSD. You know,
So, by the way, to hit that, the
uh,
grief cycle, just looked it up. Episodes 2106 and 2107 are where you can go look and get more information on the grief cycle as well.
That was uh, that was such a lovely show. We had to do it twice,
Hmm.
but it's a lot of good information, folks. Please feel free to peruse through it, to fast forward through it, to learn more about it, to go out there and do your own research, please. So, why do we use MDMA for PTSD? Why has this become something that is effective for military personnel, where some of the other stuff maybe hasn't shown as much effectiveness? Not that the other stuff doesn't work, it just takes a little bit longer for it to kick in, right? You're not going to go into one or two therapy sessions and be cured. That's not how it works, right? This is an ongoing thing. This is something that you might have been living with for 20 plus years. You're not going to be completely cured after two sessions of talk therapy. Okay. That said, with MDMA, when you're using MDMA alongside therapy, right,
Hmm.
it increases your empathy. It increases how you feel as far as close with the patient therapist relationship. It increases your relaxation. It increases your motivation to engage. And also, and here's what it did for me. It increased my introspective, right? It reduced the depression and the anxiety associated with having to tell my story, because every time you go in there, that is the first thing they want you to do. They want you to relive this, effing horrible thing that happened to you, thinking, oh, well, if you talk about it enough, it's going to go away. And sometimes you just leave that place feeling worse than when you came in, because you had to relive this whole horrible thing, right? So what it does here is it reduces all of the negative stuff and allows you to start dealing with it. Okay. So
Yes. So a way that I've described this, and again, like, maybe it's Rod's words and they hit you perfectly. Maybe it's mine. Doesn't matter. Like whatever helps you understand this. Because of the neurotransmitters being released and because of the feeling that that provides, it's called a heart opener. You basically just feel safe, right? And in feeling safe, you're able to access the emotions, the memories, the experiences, other things that you wouldn't otherwise be able to do. And whatever triggers that you might have, it's like for just a period of time, like somebody goes in and just disarms all those little triggers. And so you're actually able to go through and feel the emotions, process the experiences, have the memories and everything else come up, but in a way where you're processing through them. You're not just reliving them and re-traumatizing yourself. You can actually, again, with guidance, go through and process them to allow that cycle, that running thing that's going on over and over and over again, to finally be released. And that's the power of it.
And yes, all these things, as stated on the slide, they increase the success of psychotherapy, right? They increase your success rate. And in 2017, the FDA cleared the use of MDMA for psychotherapy. Currently, a phase three study, well, a few case three studies have indicated that MDMA assisted therapy is a breakthrough treatment. Okay, that is everything I read, the whole breakthrough part just kind of pushes how well this has been received by people having to take it, people going through this, people living through this. Okay, so adverse effects. So what to expect? What are the downsides of it? Well, they can last from a few hours to several days, and they can include a diminished appetite, anxiety, headache, jaw tightness, tinnitus, that's the ringing in your ears, nausea when you feel you need to vomit, uh, aesthesia or perceived muscle weakness. It doesn't actually weaken your muscles, but they feel that you are now weaker. This is something I definitely experienced. Fatigue, something that I also experienced. You're just tired. It's very physically draining.
Mm-hmm.
Acute sinusitis, and I'm going to probably butcher this word, nasopharyngitis, upper respiratory tract infection,
Nasopharyngitis.
nasal
There we go.
pharyngitis. Yes,
Yeah.
it's naso, not naso. Oh man, English, I tell you.
I didn't know. I was literally figuring it out as you were. So,
Ah, so a disturbance in the force or a disturbance in attention. Uh, some people have experienced tremors, tics, dysuria, erythema, erythema, and depression. So, because it does drain you, I believe it's mainly dopamine that is just like
serotonin, actually. So, like the
serotonin.
biggest thing is that you're dumping a lot of serotonin, which is, again, you feel good, calm, safe, everything else. But then it's like you're dumping your supply of that. And then your
Mhm.
body's got to rebuild those supplies. And so you can have these challenging experiences afterwards. And usually everybody just feels a little bit lower, more lethargic, physically tapped out. But if you were to do MDMA over and over again for extended periods of time, you can suffer true neurological issues. So it's not good to do that way. Like we state here, MDMA has a lethal dose. The medical term for that is an MD50. So if you take a certain amount of it, you can die. It can be a poison. The same thing is true with caffeine. The same thing is true with alcohol. There are dosages which are helpful, and especially in the therapeutic session, there are dosages which are too much, can lead towards overdose situations and being hospitalized, and there are lethal doses. We're just sharing this because be careful. This is why we're recommending do this in a therapeutic session. Do this with somebody who knows what they're doing, has gone through it, understands your body weight, what medicines, other medicines you might be on, understands your gender, and this is being catered toward you. Now, the other thing when it comes to adverse effects, and this is rare, but just because we get to share stories here, um, the reason I can't imagine partying on MDMA, I have different reasons from Rod. My reason is because the first 2 to 3 times I utilized it as a medicine, um, I'm just going to be graphic, so excuse this. I fucking puked and I had the literal nastiest shits I've ever had in my life. Like the darkest, most disgusting, and it was like just having diarrhea and the shits, and it was like tar coming out. And so I
That was
can't
your stomach.
imagine going, yeah. I can't imagine going to a rave because I'd be like every like 5 minutes, I'd be like, all right, guys, I'll be right back. Blah, ugh. Ooh, I don't feel so good.
I think there's an
Um,
episode of South Park about that. Yeah, I'm not sure.
there, there might be, but I'm only sharing that because I have found two other people who've had similar experiences with it. So just realize, like we have said before, everybody and every body is different. And so be careful. Be careful with it, because what somebody's effects are and what their adverse effects are, or even what their positive effects are, they might be different than yours. So always tread carefully and use guidance and therapy.
And again, MDMA is measured in like micrograms versus grams, so that MD50, that could be again, that line is different for everybody, but that could be the difference of a couple of micrograms. I don't want to scare anybody off from it, but
It's more
but
than a
every
couple of micrograms, but you're not gonna measure out your MDMA using a teaspoon. If you do that,
right.
you're in deep, deep trouble, right? So it's more sensitive than other drugs. So you want to be very careful and very particular with it.
Yeah. So please, 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 don't take it from street vendor Bob that you're getting the good stuff and it's so much. Go see somebody that's had some training in this to make
Yep.
sure that if there are any adverse side effects, they're not as harsh. Hopefully, you won't be exploding out both ends like Chris did, and that
And to
you don't
answer
accident.
Josh's, oh, sorry,
Yeah,
I just
that
saw
you don't
Josh's
accidentally
question.
deplete the dose. But yes, Josh has a question.
Yeah. Yes, Josh, the side effects that we're talking about here, all the stuff up here, whether you're talking about my beautiful bathroom experiences or you're talking about this stuff up here, this is temporary. The prolonged effects of abusing it are the ones that begin to have like neurological effects upon the system, including some challenges with the brain, etc. So, what we're sharing here, all of this is temporary. All of this you move through and past.
Literally, sometimes.
Dun-dun.
Da-da-da. So why do we want to use it? Well, PTSD inhibits the subject's ability to respond appropriately to trauma-related stimuli, meaning we don't take the medicine, the normal medicines, the normal therapists as good as some as other uh, mental health issues, depression, anxiety, that kind of stuff. The current model for PTSD proposes that it results from amplified and uncontrolled responses, the fight or flight, from the amygdala to trauma
Mhm.
specific cues. Oxytocin, which is increased by MDMA, has been found to increase trust and emotional awareness and reduce the amygdala responses, as well as reduce coupling of the amygdala to the brainstem regions associated with automatic and behavioral characteristics of fear, fight or
So
flight.
what that's basically saying is you fewer triggers and you don't experience the fight or flight response as easily. You
Yeah.
could, I'm guessing, still experience it, but the threshold for experiencing that is going to be way different, and that's what gives you the room for the therapies to actually work and help you through the clearing out the crud within your nervous system.
Right. And it has been proposed that these effects foster memory reconciliation by allowing the patient to access traumatic memories while still feeling detached from the sense of imminent threat. You can now look at it for what it was and say, oh, yeah, that sucked. But your body isn't going into that automatic, response of fight, flight,
Close
or
down.
freeze. The other one is freeze. And I think some of us close down and don't think about that. Okay.
Yeah.
So, should it look like? What does it look like? MDMA assisted therapy sessions can take some time. Okay. You will need two, and from what I read, three sessions are recommended over a 12-week span. Your therapist will tell you more about what to expect and how to prepare yourself. Okay. From what I read, is one dose per month with a lot of therapy in between and during. And some of the case studies that I saw is you actually get a team of two therapists while you're under, because it does take 6 to 8 hours for it to happen, right? So you need two therapists in case one of them needs to take a bathroom break or go eat lunch. This is their full day. You're going to be in there for 8 hours, right? At each
The
session.
the other reason some places are starting to go down this is also ethical. So um, when you're in those open states promoted by different medicines and psychedelics, like you could be influenced. Again, one of the reasons for using this in a truly therapeutic setting with certified people is, the old stories of somebody going uh, to an unsavory place, doing this with a guide, but also then being taken advantage of in some way, right?
Yeah,
So having the double therapists there and all the other protocols that are being put in place are to ensure that there is a totality of safety. And so
shoot.
no matter what, in a space where you are completely safe and completely open up, which allows for the healing and the moving past the trauma, the challenges, and PTSD.
It's interesting because I've even noticed that dentists have started going to the buddy approach to treating a patient. They always have somebody
Oh.
there. And when I was a teenager, I had braces. My orthodontist had an open area with multiple chairs, and it was kind of weird at first to see somebody else in another chair, kind of like a barbershop setting. But
Hmm.
it was just looking back now, knowing what I know now, it was just covering their butt from anybody even suggesting that something inappropriate was done when they were under the influence of, say, laughing gas or anything like that.
Yeah.
Um, so at each session, you'll get a tablet or a capsule with an initial dose that should be measured out to you. It usually takes about 45 minutes to take effect. Your doctor or therapist may follow up with another half dose later on in the session. It might be 2 hours. It might be as the first one is kicking in, or as however they feel is necessary. The drug effects on your brain and body can last up to 8 hours, which gives you time to revisit and work through painful events. And I got to say, from having gone through it, one session was not enough for me. I knew at the end of the first session that I needed to come back and continue. I just, something inside me said, "You are not done. You've done all this work, but there's still more to do." And I remember as I was coming out of the drug, wanting to come back and just like holding on for dear life to just like, no, I'm not finished. So uh, maybe you'll have the same experience as I did, but you will know when it is definitely taken effect. I By the time I did the second session, for me personally, I was like, oh, whew, well, that was anticlimactic. It's like it only took a couple of sessions versus however many years I'd already had of therapy at that point. So keep that in mind. It does last a long time. You're probably going to, if you go through a clinic, you probably will get two people in there to help. Um, at least two psychotherapists will be there for the whole session to help you through what can be physically and emotionally draining. There will usually be one session every 4 to 6 weeks, leaving time for integration. Okay, this is not a okay. I feel I need more work that needs to be done. Let me take some more and keep going. We're not gonna. We're not. They shouldn't try
It's
to
it's
put you
like
through a 16 or 24-hour MDMA session.
yeah. So it's like think about it in terms of like working out and muscle growth, right? There's a certain amount of work to be done, and in that, like you get the heavy lifting and stuff done, but you also then need a recovery period. Like that recovery or integration period is where a lot of the gains are made as well. And so, like just pushing harder if you're doing that physically working out, you can lead towards injury, right? So the same thing could happen by just pushing harder and trying to do it all at once. That's why these things are spaced out. Just like you would do with a workout, you're doing the same thing emotionally. And while you're under MDMA, like you just, again, because of the neurotransmitters running, you feel like I can keep going, I keep going, I keep going.
And
When
and
you
and, and
get done with it and you realize just how emotionally taxing, like physically and emotionally taxing it is, you'll be glad you stopped, you'll recover, and then you'll go back in and you'll be able to do it the next time you come in for a session.
But here's the thing, and our friend Josh just asked the question from the perspective of the person undergoing the therapy. I assume that the number of hours under the medication does not or may not feel like the 6 or 8 hours. Yes, that is true. When I when I went through MDMA therapy, the reason I wanted to go back right away is because in my mind, I felt that maybe 40 minutes to an hour, hour and a half tops had gone by. I did not realize that I had started earlier in the day and it was now nighttime. And it's kind of like I'm looking around going, what happened to the rest of the day? What happened? It's like I don't recall the exact time we started, but I was out for about 7 hours plus the 45 minutes that it took to kick in. So it was an 8 hour experience. And when you're in it, you don't realize that time is still coming. That you're conscious throughout it. You are doing the work. You're going through the hurts. You are analyzing them. You're trying to figure them out, but you don't realize how much time is actually passing. So when you come out of it, you might feel like I was only there for an hour or two, at least for me. When in
Yeah.
reality, I was there for about 6 to 8 hours. Um, and it's just it's an interesting thing. And the other side of it is, yeah, your body may not be ready for another 6 to 8 hours of this intensive, very intensive experience that you're going to be going through.
Yeah. And in terms of intensity, like when I think of intensity, I think of something incredibly strenuous, like a 24-hour, 100-mile run or anything else. Like it's not that. It's just taxing. Like imagine like the emotions that you've avoided feeling, and that energy coming out and coming through you to finally be released. Like that can be potent. That can be quite a bit. And so
Yeah,
just respect yourself. Truly care, look after yourself. Like imagine that even though this is spread out over 12 weeks, 3 months, right? That after 3 months is a strong likelihood that you don't have to experience this anymore. And if you've been living with something for 5, 10, 20 years, it's okay to have 3 months. It's
yeah.
okay.
3 more months ain't gonna kill you, bro.
Yeah. And you're going
Yeah.
to feel better after each one. So each of those months will be better than the last one as well.
Right. Right. So evidence. Scientists are still looking at trials. Again, MAPS is still looking for people to volunteer for their next sessions. Researchers say that MDMA assisted therapy may have more benefits than any other psychotherapy or medication that is now currently being used to treat severe PTSD. In fact, they say PTSD symptoms can be controlled or reduced after uh, one course of 2 to 3 sessions, right? There's the 3 sessions in that 3 months. And the benefits may be long term. One study found that 67% of people reported that they no longer met the criteria for PTSD 1 year after they finished the assisted therapy. On a
So to,
personal,
to speak to, yeah, I was just going to ask you to speak this for a moment. Like your experience with this was 2.5 years ago.
right.
What have you experienced? How's that been for you?
Uh, Honestly, I felt that after the 1 year, I want to say about let's see, I went up there during the summer.
Hmm.
Uh, I'm trying to like correlate. It felt that after about a year, I started getting some of the anxiety back. At the year and a half mark, I believe I called you and I said, I think I might need another session. My sessions were different. My sessions were 2 sessions within an 11-day span. Okay. So, did I need a third session? And maybe that would have done the trick? Possibly. However, my experience after the year, at about the year and a few months down the road, a year and a half, I feared that I was falling back into a lot of those ticks. I was having issues with concentration. I was having issues with memory again. I was having just a lot of the same stuff that I was feeling when I had been triggered previously. Um, the ones that scare me the most is those mental blanks, right? Uh, that wasn't
Well
intentional. I was
played.
just looking for the word.
Well played, Mr.
Uh,
Rod.
I was missing meetings even though I had sticky notes on my monitor. I was fumbling things, and it wasn't often, but it was happening, and that was happening a lot when I was fully triggered. When I was going through full on PTSD, PTSD for me came on as a roller coaster. Sometimes I'd be functioning just fine, and sometimes, well, shit, it's like I think I'm getting going off the rails here. And so I started noticing some of these ticks coming back, and so I was like really afraid that the medicine had worn off. Right? It's like shit. I'm back to square one. I didn't feel like I was all the way back to square one, but I did notice some of those symptoms coming back. And so I thought I needed a third session, right? And I ended up doing just a bit of a microdose of MDMA, and I went with something different. It was psilocybin for that time, and that was this past year, and I think I'm okay, at least for now. I don't know if I'm going to feel that I need another session in another year, year and a half. But for the time being, it is my belief that these issues, these symptoms, these ticks are at least at bay, if not gone. Okay. Do I still get anxiety? Do I still feel down from time to time? Yes, because life happens. But it's not a revisiting of that PTSD state where I'm reliving something horrible, or I'm not even thinking about it, but I'm just breaking down when I catch a glimpse of something. Right. One of my triggers was random visual things. Um, for whatever reason, driving through certain parts of New Mexico. New Mexico, if you're familiar with the state, can be a very arid area. I would get triggered to the point where I had panic attacks, and I sometimes have to pull over the side of the road and just let it happen, and then continue on my way. So I don't think I'm to that point. I don't think I'll ever. I hope I will never be back to that point. Um, However, if I do start feeling the ticks again, I feel confident that either a microdose of MDMA with some psilocybin or another therapy session with MDMA should keep me going for at least another year or two. So that's
So
that's where I.
I would be curious, and I don't know the answer to this. This is truly a question. Um, when you what you experienced for I think about 20 years that we called PTSD, and then like what began to creep up after there. I wonder if they're the same thing or if it's kind of like the emotional crud that begins to build up back again in life, right? Because there's a difference between having like a triggering trauma, very hardened, if you will,
Mhm.
catalyzed emotional experience that is often the trigger for PTSD, and then it's like in life, sometimes our pipes get a little dirty from the emotional stuff that we don't resolve, right?
Right.
Because we haven't had the practice of dealing with our emotional stuff when we've been avoiding our triggers and everything else for so long, right? And so I'm not trying to lead this question, but I'd be curious for
No.
you is um, after the treatment for PTSD, whether it was the PTSD creeping back in, if you will, like a reinstantiation of it, or whether it was just life causes emotional crud to build up on the pipes, and every so often, whether it's going out into the desert and screaming, or an additional medicine, or going on an adventure, or something like some way, like going out into nature with a bunch of guys and screaming around the fire, like it some way to essentially clear out the pipes again to get back to that normal baseline that you were
Uh,
able to have after the treatment.
and honestly, I don't know. There could be
Yeah.
the possibility of that. My fear was not the emotional crud, if you would.
Mm.
I was okay with the emotions. I learned to be okay with the emotions after the MDMA. My fear
Mm.
was the memory glitches, if you would, were starting to feel like early onset. Um, See what I mean? It's the loss of motor
Dementia, Alzheimer's.
dementia or Alzheimer's, something like that. I I
Yeah.
I I don't want to say dementia because I knew who I was, where I was, and all that kind of thing. But
Mm.
I just started missing things. So Alzheimer's, dementia, I don't know. It was just like I could feel like the lights were shut off in my brain for a minute or two, and then they'd come back on, and I'd be in that weird state of like, what the hell happened, right?
Hmm.
So it's like my life is a movie reel and somebody cut out a clip and then spliced it together. So I found that happening, and that to me was the scary part, where I'm literally missing, snippets of my day or snippets of my life, and I'm just like, to me that was the scary part, and that was something that became evident to me was happening when my PTSD started getting out of control,
Mm. Okay.
where I would start the car and end up somewhere not knowing where I was because I went on autopilot and I have no clue where I'm at. So it wasn't to that extent, but I started noticing that kind of thing happening a couple of times. Not every day, but just like a couple of times enough to kind of like get a red flag going. It's like, what the hell happened? I just missed something, and it's
Mm.
and in my mind, no time had passed, but I've already missed an hour of a meeting, or I've already missed, this or that, and especially when I was left alone. If other people I was interacting with or whatnot, I was more prone to being there. However, if I had to be in my classroom by myself, like I said, I know I've had memory glitches in the past. So what I started doing is I started writing stickies to myself and posting them on my monitor, and that kept me okay for a little bit. And then I'd be sitting there and I would totally ignore the sticky. I'd be just sitting in front of the computer, and I'd look up and I'd be late for a meeting because I like lost time for 5-10 minutes, and now I got to like
Hmm.
go run across campus because I missed it, that kind of
Mm.
thing. So to me, that was the scary part. When that started happening to me again, I was like, crap, I think the PTSD is acting up again. Like, it's a freaking flare up, right?
Yeah.
But it felt that way. It definitely felt that way. And I also, maybe because of the fear that goes along with missing part of your day, but I also
Yeah.
find myself more prone to anger, you
Mm.
know, that irritability and that
Yeah.
anxiety that goes along with it. And I'm just like, I'm falling into my old ways. I need to get out of this mindset. I need to figure out
Yeah.
what's going on.
I,
So,
I can get in a different way. I can get a part of that. So I remember like some of the liberation that I felt from some of the medicine experiences I've had, and then when I come back into life and some of the old patterns would reemerge, um, I would feel fearful. Um, yes, sorry. If you want to put Josh's comment up there, I think this is a great one. Perhaps the corollary is earthquake, though, with aftershocks. You no longer hit the high magnitude tremors, but you might still have residual smaller aftershocks. Yes.
definitely
Um,
felt that. Yeah.
yeah, I think that's a great way to describe it. And thank you for that, Josh, because that's what I would experience. And then when I feel the aftershock, for using this analogy, great one, um, then my fear of, oh, I don't want to go back to where I was, like having spent, decades. For me, it was, depression and everything else, but having spent decades experiencing that, when something felt like that was coming back again, like I would be hypersensitive to it. And that
Yeah.
would kind of like create its own little cycle of fear. What I learned over time is exactly what Josh shared, is like it's like just a little aftershock coming, and then it goes away, and another one coming, and each one of those gets lower and lower and lower. And then simultaneously, I had to learn how to deal with the day-to-day emotions and other emotions that I hadn't had to deal with yet because they weren't nearly as big a deal in my life. And so like the journey continues.
Yeah. Yeah.
Yeah.
So to finish up the slide, because the treatment is given in a controlled setting, potential for abuse is low. MDMA is also proving to be a cheaper than other alternative therapies for severe PTSD that may take longer and need more drugs and more professional assistance. Therapists are not cheap. If you're getting them free through the VA, you know, Bravo Zulu. But if you're having to pay out of pocket, they can be quite expensive. If your insurance doesn't cover it, or they only cover partial payment of it, it can be expensive. So with MDMA therapy, we're looking at 3 intensive months, and then possibly not a lot of therapy afterwards. What I found in my case is that instead of going twice a week to see my counselors, I am now at the point where I talk to my counselor on a one-time monthly basis, right? So that is a huge, to me, that's a measure of how far I've come.
And this is just my personal view. I honestly believe that everybody, whether it's a very dear friend or a counselor or somebody, I think everybody should talk to somebody at least once a month, like our
Yeah.
therapist, right? Like we live in a world that's constantly giving us things that are need to be released, that need to be understood, need to be integrated, need to be dealt with. And so, like part of the owner's manual of being a human being should thou will talk to somebody once a month and let this stuff out and gain perspective and deal with it.
Yeah.
So I think that's actually, regardless of where you are in your path, I think that that is a very healthy thing to do as well.
Oddly enough, I did buy a copy of that Dr. Oz book, You, the Owner's Manual. Didn't talk about
Yeah.
mental health at all. It didn't talk about PTSD. It didn't talk about any of that. And I was like, damn it, I just wasted my money. I don't care about diet and exercise.
Exactly. Oh, just what I put into my body and how this body works doesn't matter at all. But yeah.
At that moment, that
It
wasn't what I
wasn't.
was
It
looking
wasn't the
for.
most pressing thing, right?
Yeah.
Again, like with this, it's like focus on the thing that's causing the most challenge in your life. Get this
Yeah.
resolved, and then when this isn't there, like something else will be there, and you get to work on that, and then you get to work on the next. You get to work on the next. But prioritizing can be helpful.
Yeah. Alrighty. Mr. Jaw says, what you're saying is earthquakes are okay, volcanoes are not.
Yeah, i.e. the triggers.
The
Yeah,
triggers,
100%.
the
Yeah.
explosions,
Yep.
yeah. Outcomes. So, according to the MAPS, or the multidisciplinary, can't talk now, Multidisciplinary Association for Psychedelic Studies, MDMA was administered, and this is the study that they were talking about, to approximately 1,700 human subjects with only one serious adverse reaction. I actually tried to look for that one serious adverse reaction. Nothing else was mentioned. I wanted to know what happened to the guy. I really wanted to know if he was given an accidental lethal dose, or his PTSD was just so bad that nothing helped him. I was curious. I don't know what happened. So 67% of the participants with PTSD no longer met PTSD diagnostic criteria 2 months after their third session. So this is 5 months in, right? And then later they looked at it a year later, and I believe I mentioned it in the previous slide, that those 67% still held a year later.
Yep.
33% of the participants met criteria for PTSD remission after 3 sessions. So for those people, even though it didn't get rid of all of the triggers, they still went into remission, meaning that they weren't triggered as easily. Um, so to me, that's a win. You add those two together, it's almost 100%, except for that one person. You never know if you're going to be that one person. And honestly, if the
But
numbers are good, these are really good odds, especially for something as bad as PTSD.
these are betting odds, and again, just to put this in perspective, like something that somebody has experienced for 5, 10, or 20 years, like you've been with this for 5, 10, or 20 years, that the very strong potential that 3 sessions, well done, with truly, trustworthy guides, therapists, and everything else alongside of it, and you could, at the very least, be in remission, but very, like, more likely have been cured of it, right? To not have to experience that again. That's powerful for something that people are living with for many years, if not decades, and are often told, just take this drug, often, some type of opioid, and be on this for the rest of your life, and good luck. Like this
Yeah.
right here, that's why they call it a breakthrough treatment, because this is so powerful and such a change in dynamic to help people through this. It's why I'm such an advocate of this. I'm not saying that this is right for you. You're the only one who can make that choice. However, what I am saying is shortlist this, because this is truly, truly powerful, and definitely look into it for you.
Yeah, no, definitely. It made a difference in my life. Even though I had to go back a year and a half later for that third dosage. Like I said, my third dosage was just, I believe it was a microdose of MDMA and psilocybin. So far so good. Knock on wood. We're still doing okay. Still feeling good about that. But yeah, I feel that if in a year or two, if I start feeling those same um, um, triggers, that I now have something that I can now go to and do maybe once every 2 years instead of having to be on a regular regimen of opioids or whatever medicine, um, that is being prescribed to you. Um, maybe not a huge moneymaker for the drug companies out there, but it's definitely um, made a difference in my life.
And now if we're talking about just like again the owner's manual of being human, um, you don't have to subscribe to this belief. This is now just my belief and everything else. I think that once every year, once every 2 years, like as part of being a human, again, it's to have an experience like this that helps you clear out the emotions, helps you deal with whatever might have accumulated over the time, helps you go deeper into maybe you don't have a trigger around something, but there's still some emotional hurts that need to be resolved. And every time you go through a session like this, you get to go through a bit more. You get to like, clear things out a bit more. You get to live a more present and conscious and joyous life. And so, if we could say every person in the world is gifted with somebody to talk to once a month and some treatment like this to be able to do once a year, once every 2 years, I truly believe we would be in a way more present, way more caring, way less assholish and triggered society.
Yeah. Yeah. Things to know: if you have been diagnosed with a severe form of PTSD and you're interested in MDMA assisted therapy, it is important to remember that this treatment should be done only with an expert in a clinical setting. MDMA assisted therapy should not be confused with recreational ecstasy, and I think we've harped on that quite a bit. Street drugs do not have the same therapeutic effects. In fact, researchers say that ecstasy that's bought illegally may have other ingredients such as the methamphetamines, ketamine, caffeine, ephedrine. Combination can be dangerous for your health. MDMA assisted therapy isn't right for everyone, everybody, right? You must be physically cleared before you can take it. If you're interested in trying MDMA to help with severe PTSD symptoms, talk to your doctor or your therapist about whether it might work for you. And like I said, if you go to the MAPS website, you can even sign up to be part of their study. They are currently actively looking for people to participate in further studies. Okay. Um, the Substance Abuse and Mental Health Services Administration has a couple of phone numbers for us. Find a facility near you. You can go to https // The National Suicide Prevention Lifeline is 1-800 273 talk, or that is 1-800 273 8255. Behavioral Health Treatment Locator is https / find treatment.samhsa.gov. And the SAMHSA National Helpline is 1-800 662 4357. Anything you'd like to add, sir?
Just we've said this multiple times, and I'm just gonna to state it one more time here because I think it may be helpful. Um, there is nothing wrong with the experiences that you might be having. If you're suffering from trauma or PTSD, there's nothing wrong. You're not broken. You're not irreparable. You're not stuck that way forever. And we're sharing these different therapies and ways to go because we know that. We've experienced that, not only for ourselves, but other people that we know and love and care about. And if this is something that you're experiencing, on your short list, I would put MDMA therapy because it is highly effective, more effective than the other treatments that we're aware of, higher cure rate, shorter amount of time. It does not take away the need for therapy and other things. Those things will continue to help you. The meditation, yoga, they'll continue to help you. Part of the owner's manual of being human. But if you're looking at this and going, well, that's fine, but I could never take a drug, or there's some other reason that you're against this, I just ask you to look at your beliefs and make sure that they're truly serving you. Because when you're weighing what is it like to live with this experience? And what is it like for the people around you to live with this experience for another 1, 2, 3, 5, 10 years versus very potentially this year of your life being able to move beyond this, to move through this, to be back on even ground, to be out of the foxhole, as we often say, on there on even ground with everybody. Doesn't mean that you're going to be perfect. Doesn't mean that all of a sudden you're a saint. Doesn't mean that all of your troubles in the world go away. But man, you're actually on solid ground again with everybody else. You're able to be there at the actual starting line of life and have a chance to enjoy the race, right? Maybe it's not a race, the walk, the journey, the hike, whatever we want to call it. It is powerful. So definitely keep that in mind. They're right for you. I'm not here to tell you what your belief should be, but I can definitely guide you to taking a very serious look at this particular therapy.
Yeah, it's definitely something I too would recommend. Um, and it wasn't like a light bulb turning on for me. I remember after the first session, um, just being able to go to a store, just being able to go to a crowded store and not feel that immediate rage and road rage, right? Of taking a shopping cart through Walmart. Just something that simple. As I was walking through, just realizing I'm not having a panic attack. I'm not angry. I don't want to kill everybody in front of me because they're being slow. I just, it was, like I said, anticlimactic. It's like, okay, I'm out here with all these other people and I'm not getting triggered. Huh. That was it.
Yeah.
That was it. And to have had PTSD for, I believe it was at the 23-year mark is when I finally uh, started getting help. Um, the only thing I can say is I kick myself for not having started earlier. By the time I went through with the MDMA, I'd already been in talk therapy for about a year, and this was definitely a giant leap um, from talk therapy to the MDMA for me, and it just allowed me to be more present in the talk therapy when I came back and to actually be disconnected from the trauma. Just realize it's something that happened to me, not something happening to me. And it was just eye opening. And
Yeah.
yeah, if any of you are interested in it, please give it a shot. Go to the MAPS website, sign up for a clinical trial, talk to your therapist. It sounds like they are allowing it to be used as part of the assisted therapy. Um, in my research, I did find that a lot of these clinics are setting up for it to be used much like the ketamine treatments that we spoke of in a couple of episodes back. Um, Give it a shot. Give it a shot.
Yeah. And then in addition to what your life could be, like Rod shared, I think this was episode 1. If not 1, it was 2. Um, the different relationship that he's been able to have with his wife and his daughter, like
Yeah,
the people around him that he truly loves and cares about, right? So if it's not for you, like maybe this is something that helps somebody that you love,
yeah,
right? Just by you being different and being able to be like who you are, the unhurt person that's truly inside of you. Um, yeah,
yeah. If we get comfortable being an a-hole, but we know we can't be an a-hole to everybody. So do it for your loved ones. If you're comfortable being an a-hole, do it for those you love. Maybe they're not comfortable with you being Captain A-hole all the time. Yeah.
all
With
right.
that, I think this is a great place to stop the show. We've gotten over a little bit past our normal hour. Thank you for staying with us, folks. Um, this is something that both Chris and I hold very dear to our hearts. This is something that we both believe in. This is something that we both hope, dream, aspire to get the word out, to get more people informed and involved and evolved. So if you would like to continue listening to us talk and present, feel free to join us next week, Friday, 7 p.m. Mountain Standard. We'll find something interesting to talk about and go between.
All right. Big
Thank you.
love. Be well.